This interview will feature Dr. Elizabeth Berry-Kravis, who is a pediatric neurologist and professor of pediatrics and neurological sciences at Rush University Medical Center in Chicago. She is a co-PI on the SCGE project titled A Non-Viral CRISPR-Mediated Genome Editing Delivery Platform as a Potential Therapy for Neurogenetic Diseases. So what specifically do you work on within your SCGE research project?
We're in preclinical studies right now. My role is to run a early phase clinical trial once we get done with the preclinical studies to test this and find out, potentially if it is safe and if it will get an idea of whether it will work in patients with Angelman syndrome.
Great. Thank you for answering that very in depth. What's your favorite thing about working either on this research project or research in general?
I've been in research for 35 years, so it's not like it's new to me or anything. I think the exciting thing about this day and age with respect to research is that we're making progress on actually treating neurogenetic conditions that we couldn't hope to treat in the past, and that we just had nothing for families to take home. So the excitement is the potential for treatment of patients with horrible diseases that have previously been untreatable.
For this SCGE project, what's something cool or interesting that you and your team have found in your research so far?
Well, it's in the first year of the grant. So I think what's interesting has been, that we continue to see evidence that that the delivery system and the gene editing system will be effective. And I think what's been cool is we've had some, good FDA interactions where we've been able to delineate very, pretty well what our path forward is and what we have to demonstrate in order to take the reagents into the clinic. I think really the exciting thing about this particular project and this particular delivery of reagents is that it's not viral dependent. So all of the problems that go along with trying to deliver AAV9 to neural cells, and with having to express the immune system, and with people not being eligible for treatment because they've been infected previously with AAV9, we don't have those issues in this. So this could be, really a major advance. And so I think that's, those are the things that are most exciting about it.
And then kind of going more broadly now than your SCGE project, what's an advancement that you think will happen in the genome editing or gene therapy field in the next 10 years or so?
Well, I think there will be a lot of advancements. I think we're at the verge of actually being able to do this. And I think there have been a couple things done in the periphery. I think the big advancement will be being able to have gene editing that can be delivered to the brain for brain diseases. That's been, an issue. I think an advancement will be non-viral delivery systems, and being able to get those effectively into neurons, which would basically allow us to genetically reverse a lot of neurological diseases.
How do you and your team engage with patients or patient advocacy groups in your research?
I, I'm on the I engage with a huge number of patient advocacy groups for neurodevelopmental disorders, the advocacy groups for Fragile X, for Angelman syndrome, for Phelan-McDermott syndrome, for Rett syndrome, for Niemann-Pick type C, for Batten's disease. It's a long list. And we engage continuously to get feedback about what families and patients want, and as well as provide them with information about what's coming forward in the future, and what and what might possibly be a treatment, and how might that be delivered, and is that something that they could do, is that something they want. It's a continuous back and forth with these patient advocacy groups with rare diseases. And then with patients, I think most patients come in and they just would like to hear if you have anything you can do to treat their disease rather than just supportive care. And so what I do is try to really provide the best supportive care that's available, but also keep them updated on what's going on in research, and, how long it might be before it goes into a clinical trial, but also that we really, help them stay evenly balanced in terms of we don't really know how any of these things will work or how well they'll work or how old before you can reverse a disease. And, I try to educate them on these general concepts of trying to treat, a genetic neurological disease, as well as just letting them know, so there's hope that this is what we have coming forward for your disease.
How do you and your team consider health equity in your research?
So I think there are very few research projects that truly have equity. If by health equity, you mean equity among all, socioeconomic statuses and racial and ethnic groups. I think that we don't accomplish that in general. I think in clinic, we do a much, we have clinics for specialty clinics for certain diseases. We have patients of all, ethnic groups and socioeconomic status. We get them into clinic and we really manage patients the same. I mean, I'm gonna, provide best care no matter what your status is. But in research, many people with lower socioeconomic achievement or who are underrepresented minorities often do not get into research, and we don't quite know why that is. But I also think that ultimately our goal is to treat everybody, right, regardless of race or socioeconomic status or anything. The only way we can get to a point of treating everybody is to get drugs approved. I mean, we obviously don't turn down anyone of any racial or ethnic group, but sometimes we just don't have people contacting us from certain groups. So, we move forward with the people that have contacted us and that want to participate. And the goal is that, we're going to try this on a small number of patients, and then hopefully it's going to move forward. And, once we can use this as a treatment, we would have available for everyone of all groups. But I think we all know that in research in general, we do not have equal representation of some of the underrepresented groups.
Do you think that there is anything that researchers in general or funding bodies could do to kind of help improve health equity within the research field?
Funding bodies are requiring that we make an attempt to have equal representation, and that's good. It's motivating. The problem is it's really kind of a matter of, fixing things that are way beyond our ability to fix within like a research grant, for instance. I mean, people in the inner city don't get as much testing. They don't have the resources. They're dealing with how to get food on the table tomorrow, which is a much bigger priority than having their kid with developmental delay go in and get genetic testing. Okay, so we have to fix the ills of the world before we can truly get equity in research participation or even in specialty clinic participation. Patients get to our clinic because their doctor refers them, and so they come to our clinic. They don't have to sort of generate it spontaneously. If they want to be in a research project, they have to hear about it, and then they have to decide they want to participate. If they come into our clinic, we offer it to them. Sometimes the problems that they're dealing with are really just too big for them to come in to frequent appointments, or in the case of gene therapy, to come and be in the hospital for a while. And so we tend to have a higher socioeconomic group enrolling in those early, very intensive studies. And that is not because we're filtering, it is simply who approaches us. We would love to be able to have complete equity. And I think you can put as many requirements as you want in grants, and we're going to try to come up with stuff that will address those requirements. But in the end, we are not going to have complete equity, is what I think. I mean, there could be people that think other things, but that's what I think. I think we have to fix the fact that this family is trying to figure out how they're going to get food on the table the next day before we can expect them to come in and sign up for voluntary research projects.
Great, thank you. Is there anything else that you want to say about your project or your research in general or the SCGE, just anything that you would like to end with?
I think the consortium is great. I think it's been very helpful for people to share information and cross-fertilize projects. I think that's really a wonderful thing. I think, as you know, gene editing is gonna, hit medicine, kind of like a bulldozer in the next like decade. And I I'm not sure we're ready for it. I'm not sure we have enough geneticists, genetic counselors, people that do translational research. I think we're understaffed in all those areas in the clinic. But I see it coming, and I can see what the future is. And I think it's very exciting because we have so many diseases we simply can't treat. And there's some diseases that we will not be able to reverse after a certain age. But there's others that we will, and that's going to provide a huge amount of hope to all of these, patients with genetic diseases. And I think it's moving so fast, we can't even predict where we'll be 10 years from now. Let's make one more comment, which is that the reason I went into pediatric neurology, back, when I was in medical school in like 1988 was that, or in 1985 is when I first committed to it, was that there was so little known about the brain and what caused all of the, pediatric neurological diseases that we saw, that I thought, well, this is an area where research can really make a difference because we don't know anything, and anything we learn is going to be, very impactful. And I thought that all of these things like gene therapy and, some of the work with ASOs was going to mature much faster. And like we would have it like by the early 2000s at that time. And so basically in my career, I've been waiting 30 years for this to happen. And now people say to me, well, are you going to retire? And I'm like, no, because, finally what I went into the field to do is actually happening. So I'm not going to let everybody else get the good part, right? So anyway, I think there's tremendous promise. I think we need to learn a lot. There are going to be side effects. There are going to be things we need to figure out. We're going to have bumps, but I think this is opening up a whole new world of treatment to medicine.